Hello everyone. This lecture is on anal sonography, a rare and novel topic in ultrasound. Uh, in this, it will be covered in two parts. This first lecture will be on anatomy, technique, and protocols. Why anal sonography is important? Incomplete treatment of pathology can lead to significant morbidity due to deep extension of the abscess, involvement of the anal and pelvic musculature, perianal spaces, and high rate of recurrence because of lack of knowledge of the pathology and anatomy. So, anal sonography will be covered under these headings: anatomy, pathophysiology, classification of fistula types, its implication for therapy, and technique of sonography and sonography of anal pathology. If you would like to listen to this lecture, please log on to sonoshed.in. Thank you.